Welcome to the Northwest Florida State College Radiography Program online information session. My name is Grace Stewart and I'm the program director, and my phone number is right here at the screen, 729-6462. Feel free to give me a call anytime if you have any questions. The radiographer is a skilled healthcare professional qualified to provide patient services using image modalities as directed by qualified physicians. Radiographers work in a variety of areas of medical imaging, including general radiography, fluoroscopy, surgical radiography, trauma radiography, and pediatric radiography. With additional training and education, radiographers also perform computed tomography, magnetic resonance imaging, ultrasound, nuclear medicine, PET scanning, mammography, radiation oncology, and angiography or interventional exams. Now, some of these areas, such as computed tomography and magnetic resonance imaging, you can learn on the job as a general radiographer, and that also goes for the angiography and interventional exams. Some of the other ones, such as ultrasound, nuclear medicine, PET scanning, mammography, radiation oncology, you may have to have additional education past the regular AS degree. It's usually a one-year certificate program. Radiographers with advanced degrees may also work in hospital management, education, or sales and marketing. And radiographers work in a variety of different settings, from ERs to general hospitals, clinics, physicians' offices, mobile radiography. And if you want to learn more about radiography, please visit www.asrt.org. And I would highly encourage you as a student radiographer to join this society. It gives you lots of information about radiography and also good scholarship opportunities as well. As a student radiographer, you will be in clinic the very first semester of the program. You will perform radiographic examinations under direct supervision, and you are also a vital part of the healthcare team. Our energized lab is computed radiography equipment. We have radiography compatible mannequins and also radiopaque phantoms, which will help us with our educational process in the lab. Program requirements. Each student must earn a grade of 75 or higher to successfully complete each radiography course. Incomplete grades may be allowed for certain didactic classroom courses. However, incompletes are not allowed for clinical coursework. Excessive absences will result in a failing grade in clinic, and failure to successfully complete requirements will also result in a failing grade in clinic. The radiography program mission is to prepare students to become competent, registry-eligible, entry-level radiographers who are able to function efficiently within the healthcare community. The radiography program has 4 major program goals and 3 program outcomes. Each program goal identifies specific student learning outcomes. The goals and the outcomes are: Goal 1, students will be clinically competent. The student learning outcomes: the student will demonstrate cognitive knowledge. The students will discern direct and indirect supervision based on level of achieved competence. Students will apply positioning skills. Students will determine and select technical factors. Students will demonstrate technical competence. Students will utilize radiation protection for patients, self, and others. Goal 2, students will demonstrate communication skills. The student learning outcomes are: the student will demonstrate effective written and oral communication skills. Students will demonstrate effective use of verbal and nonverbal communications. Students will practice radiography characterized by the use of appropriate communication skills, including the ability to read, comprehend, and analyze information. Goal 3, students will develop critical thinking skills. The student learning outcomes are: students will adapt standard procedures for non-routine patients. Students will produce quality images with minimal repeats. And students will evaluate images to determine visibility of correct anatomy and diagnostic quality. Goal 4, students will model professionalism. Student learning outcomes are: the students will demonstrate appropriate work ethics. Students will employ soft skills to understand self and others to benefit student, employee, and patient relations. Students will recognize the value of lifelong learning and pursue self-development of skills through continued learning opportunities and the understanding of professional development. The radiography program outcomes: upon completion of the radiography program, the graduate will apply for, take, and pass the American Registry of Radiologic Technologists examination, apply for part-time or full-time employment in the field, and apply for Advanced Program of Study. Accreditation. The NWFSC Radiography Program is currently accredited by the Southern Association of Colleges and Schools. This means that you are eligible to take the ARRT certifying examination. NWFSC reserves the right to refuse exam participation due to unsatisfactory scholastic or clinical achievement. Additionally, NWFSC is seeking accreditation by the Joint Review Committee on Education in Radiologic Technology, JCERT. Admissions. Please visit our website for the current admissions process. Ethical requirements. Ethical behavior eligibility requirement. The American Registry of Radiologic Technologists, the ARRT, says that ethical behavior requirements specify that every applicant for certification must be a person of good moral character and must not have engaged in conduct that is inconsistent with the ART rules of ethics, and they must agree to comply with the ART rules and regulations and the ART standards of ethics. Applicants should be aware of this limitation on certification prior to entering the radiologic technology program. Practice of deceit in the application procedure is cause for dismissal from the program. One issue addressed by the rules of ethics is the conviction of a crime, including a felony, a gross misdemeanor, or a misdemeanor, with the sole exception of speeding and parking violations. All alcohol and/or drug-related violations must be reported. Conviction as used in this provision includes a criminal proceeding where the individual enters a plea of guilty or nolo contendere. All potential violations must be investigated by the ART in order to determine eligibility. Further information may be found at www.arrt.org in the Ethics section. So visit this site to fill out an ethics review. This is the site you will go to if you have any concerns, considerations for anything that you have done in your past. You're going to go to this website and fill out a pre-application. I highly encourage this because you don't want to spend 5 semesters in this program and then realize at the end that you are not even eligible to sit for the radiography board. So fill out the pre-application and they will let you know one way or the other whether or not you are going to even be eligible to sit for the registry. And once they send you the certificate, if it says that you will not have any problems, make sure you hold on to that, and we will mail a copy of that back in when it's time to verify your completion of educational requirements. The job market for radiography is pretty good, actually. Radiographers can begin salaries between $30,000 and $40,000 for full-time plus benefits. Additional compensation can be gained through on-call, overtime, and specializations such as being a CT tech. But realize that employment in the local area may not be available upon graduation. Again, employment in the local area may not be available upon graduation. Make sure to check out the local facility websites for a listing of open positions and job descriptions. The job outlook, according to the Bureau of Labor and Statistics, is projected to grow faster than average for radiography. Those with knowledge of more than one diagnostic imaging procedure, such as CT, MR, and mammography, will have the best employment opportunities. Employment of radiologic technologists is expected to increase by about 28% from 2010 to 2020, faster than the average for all occupations. And here's the link to that web page. You can go ahead and look for yourself. The radiography program at Northwest Florida State College is 5 semesters in length. The student will be in clinic and classroom from the very first semester. There are several clinical sites that the student will rotate through, including Fort Walton Beach Medical Center, Twin Cities Hospital, North Okaloosa Medical Center, White Wilson, Sacred Heart of the Emerald Coast, Orthopedic Associates, and there are a couple of other facilities that we are working to get rotations. The clinical coordinator schedules the clinical rotation, so be prepared to visit all clinical sites during the program. A student doesn't stay at one single facility the entire program because we want to get all of the students a well-rounded education, and by visiting the different clinical sites and utilizing the different equipment and the type of exams that are done, we believe we have accomplished this. On this slide, when you click that hyperlink, it will bring you to our weighted point system. So the box at the top will give you the general requirements to be eligible for the weighted point system. And once you've completed that, you can see where we've assessed points for each of the categories A through H. So make sure you go through those and look. And also, if you have any questions, give me a call at 729-6462. But just realize that your A&P 1 and 2, or your human structures and function, must have been completed within the last 5 years. There are technical standards each applicant must possess. Sufficient eyesight so you may be able to observe your patient, manipulate the equipment, and evaluate the quality of images. You need sufficient hearing so that you're able to assess your patient and be able to verbally communicate with other healthcare providers. Verbal and writing skills are necessary so communication is prompt and clear. The radiographer is required to obtain medical histories and be able to document that information correctly. Each student will need sufficient gross fine and fine motor skills so that the student will be able to respond to a patient's needs, manipulate equipment from portable x-ray machines to transferring patients on stretchers. Each student needs to be able to lift a minimum of 30 pounds and be part of the transfer team that will move patients from imaging tables to stretchers and so on. The student needs satisfactory intellectual and emotional functions to utilize critical thinking skills, apply good judgment and discretion in the safe technical performance of imaging procedures. The curriculum. With our RTE radiography classes, they must be taken in order, which means that the classes build upon each other. For instance, you will not take Clinic 2 in front of Clinic 1. You will not take Technique 2 class if you have not passed Technique 1 class, etc. Other general education courses must be completed in order to satisfy the Radiography Associate Degree Program requirements. So what this means is if you have completed your mathematics and your science, such as A&P 1 and 2 or human structure and function, that will get you in the program, there still are other GE requirements that must be met before you can graduate with your associate's degree. So make sure that you are taking those classes that you may need to complete your AS degree as we are taking these core courses. And you can get in touch with the advisor, Sandy Bishop, if you have any questions about that. And I have her name at the end of the slide. Algebraic math and anatomical sciences, science skills are stressed in this core curriculum. So we do several formulas. You'll have to calculate ratios. You'll have to calculate times that you'll need to make a radiographic exposure. And also obviously anatomic sciences. We are going to know all of the bones in the body, and when we turn them a certain way, what you will see. We require the HESI test as part of the admissions process. In the HESI test, you'll be tested in various categories such as anatomy and physiology, English, and math. And under the English, you will be tested on reading comprehension, vocabulary and general knowledge, and grammar. You can take the HESI test in the Student Services Center, and you must create an Evolve account in order to take this test, and those instructions are on the next slide. You must score a minimum of 70 on the comprehensive test, so overall you must score a 70. The HESI may only be taken twice during an admission cycle, and the test results are good for the current testing cycle only. So make sure that you study for the HESI, prepare yourself, go online, go to a browser and look at HESI testing if you need to refresh your self on any of these subject matters. But realize you can only take it twice during an admission cycle, and it's only good for that current testing cycle. And here are instructions for the HESI admission assessment. You can read these on your own. You have to create an Evolve account before you arrive to take the exam. Follow the instructions, write down your Evolve username and password, and bring them with you to the exam. You will not be permitted to take the exam unless you're able to log in with your Evolve account. And you can follow the directions here. A student is eligible for admission to the program if he or she meets all of the requirements by the established deadline. All information must be submitted on the current application forms. Each year you must submit new application forms. They do not carry over. The acceptance decisions are announced in mid-spring by calling the numbers you have listed in RadarNet, so please make sure your information is current. We have a 24 student limit. We also have a waiting list, which are our alternates. and they will be contacted by mail, then by phone if they are selected. And we usually go through our alternate list. So if you are an alternate, you may indeed be chosen for the program. If not selected for the radiography program, each year you must reapply. So I want to emphasize that. After admission to the program, but prior to enrollment in the first radiography course, the students must satisfy the following additional requirements. So realize that this is after you are admitted to the program. So do not do any of these until you are notified that you're in the program. And I'm not even going to read them. You can just look at them because we will go over them again. If you are selected into the program, you will come to the orientation on campus. So here we have a video about the first exam that you will learn as an x-ray student, and it's a PA chest exam. There's another position that we call them that goes along with this, but this right here is the first one that you will see. If you have any questions, log onto our website or contact me, Grace Stewart, Frank Sauls, who's our clinical coordinator, or Holly Salas, who's our administrative assistant. Have a great day and good luck.